Good morning, students. Today in this video lecture we are going to study about food safety. This is our fifth lecture and it comes under chapter Health and Prevention. We are going to study about the fortification of food, about the adulterations that were added nowadays in food, and various aspects of food safety. So before starting with the topic, that is fortification of food, let us know a quick history of food fortification. So as we all know, iodized salt was used in the United States before World War II. Niacin has been added to bread in USA since 1938. Vitamin D was added to margarine in Denmark in early 50s. Vitamin A and D were added to vanaspati, that is hydrogenated vegetable oils, in India since 1954 as per mandate. So now the question is, what is food fortification or the fortification of food? As per WHO, the process whereby nutrients are added to foods in relatively small quantities to maintain or to improve the quality of diet of a group, a community, or a population is called as food fortification. Also, we can say that it's the practice of adding vitamins and minerals to commonly consumed food during processing to increase their nutritional values. Food safety and food hygiene and the fortification of food, these three terms are interlinked, and it's also proven safe and cost effective strategy for improving diets and for the prevention and control of micronutrient deficiency can be overcome by the fortification of food. Globally, more than 2 billion people, including women and children, do not get the micronutrients they need to survive and thrive. The impact of micronutrient deficiencies are devastating for individuals, families, and entire country. Poor diet and limited access to nutritious food are among the key reasons why someone may lack crucial micronutrients for human development, such as iron, folic acid, vitamin A, and iodine. Food fortification has been in place in industrialized nations since the early 20th century and has helped to eliminate deficiency related disease in high income countries. Yet its success in low and middle income countries is somewhat limited. This is due to barriers such as lack of political will, which often leads to underpolization by government. Food hygiene versus food safety. Food hygiene are the conditions and measures necessary to ensure the safety of food from production to consumption. Food can become contaminated at any point during slaughtering or harvesting, processing, storage, distribution, transportation, and preparation. Lack of adequate food hygiene can lead to food-borne disease and death of the consumer. Now let's talk about food safety. Food safety is a scientific discipline describing handling, preparation, and storage of food in ways that prevent food-borne illness. This includes a number of routines that should be followed to avoid potential health hazards. Some of the important points which comes under food safety. Folic acid was added to bread for preventing neural tube defects in infant in 60s. Over the last 3 decades, fortification of food has become a public health measure for preventing deficiency of vitamin A, iron, folic acid, and iodine. Here you can see a diagram which shows the symptoms of food-borne illness, which shows fever, nausea and vomiting, dehydration, upset stomach, cramps, and diarrhea. Now let's move forward to our next topic, that is food adulteration. Now what is food adulteration? How can we prevent it? Are some of the underlying topics that we are going to study under this. Now let's study what is food adulteration. Adulteration of food, commonly defined as the addition or subtraction of any substance to or from food so that the natural composition and quality of food substance is affected. Food adulteration includes mixing, substitution, concealing the quality, putting up decomposed food for sale, misbranding, or giving false labels, and addition of toxicants. Now let's study various findings which can show the food is adulterated or not. A substance is added which depreciate, or injuriously affect it. Cheaper or inferior substances are substituted wholly or in parts. Any valuable or necessary constituent has been wholly or in part abstracted. It is an imitation. It is colored or otherwise treated to improve its appearance, or if it contains any added substance injurious to health. For whatever reason, its quality is below the standard. Adulteration can be made by three main methods, that is intentional adulteration, incidental adulteration, and the third one is metallic adulteration. The first one is done, that is intentional adulteration, for financial gain, addition of sand, marble, chips, stones, mud, other filth, talc, chalk powder, water, mineral oil, and harmful colors. The second one is incidental adulteration. This happens due to carelessness and lack in proper hygienic conditions of processing, storage, transportation, and marketing. Examples includes pesticides residue, droppings of rodents, larvas in foods. The third one is metallic adulteration. It occurs due to arsenic from pesticides, lead from water, effluent from chemical industries, tin from cans. Food adulteration has become a very common practice in our country, and we are consuming these foods almost every day, which have numerous harmful effects to our health. The usage of adulterants has increased in societies because of few legal controls on food qualities and or poor non-existent monitoring by authorities. If frequently occurs where informal food production and marketing services are predominant and enforcement of food regulation is weak. Food adulteration is unethical and called as social evil and a slow poison. Now, Let's talk about the categories of food adulterations. There are three categories, which are replacement, addition, and removal. Replacement, complete or partial replacement of a food ingredient or valuable authentic constituent with less expensive substitute with the intention of circumventing on origin and false declaration of the process. The second one is addition. Addition of small amount of non-authenticated substances to mask inferior quality ingredient. The third one is removal. Removal of authentic and valuable constituent without purchaser's knowledge. Now, let's talk about the disadvantage of food adulteration for the consumer. First one is he is paying more for the food stuff of lower quality. Second one is some form of adulteration is injurious to health, even resulting in death. Examples are addition of argemone oil to mustard oil causes epidemic dropsy. Adulteration of edible oil with tricresin phosphate resulting in paralysis and death. Next subtopic of our discussion is artificial ripening of fruits. Now, before starting, let's know what is ripening. Ripening of fruits is a natural process which makes the fruits less green, soft, and sweeter. Ripening is the physiological process by which fruit attains their desirable flavor, quality, color, palatable nature, and other textural properties. And there is composition changes. The first one is acidic content high in unripe fruit but reduced during ripening. Starch are converted to sugars by amylase. Hard pectin converted to soft one by pectinase. Artificial ripening is the process by which ripening is controlled and product may be achieved as per requirement by controlling the different parameters. It is done to achieve faster and more uniform ripening. Generally, 80% fruits are ripened artificially through ripening agents. The cosmetic quality of artificially ripened fruits will increase by organopeptic qualities, nutritional values, and shelf life are depreciated when fruits are subjected to treatment without considering maturity status.